If you are looking at IVF financing, do not start with the monthly payment. Start with the full treatment map. IVF costs can include the clinic cycle fee, monitoring, egg retrieval, anesthesia, embryo culture, embryo transfer, medications, genetic testing, embryo freezing, storage, donor sperm, donor eggs, and sometimes more than one cycle. The number shown on a clinic page may not include everything a patient eventually pays, especially medications, genetic testing, storage, and add-on services. Here are 7 questions to ask before you borrow money for IVF. Question 1. What exactly does the financing cover? Ask whether the loan or payment plan covers clinic procedures only, or whether it can also cover medications, lab work, storage, donor-related costs, and future embryo transfers. Terms vary by provider and clinic, so ask for a written breakdown. Question 2. What is excluded? This is where people get surprised. Ask whether anesthesia, ICSI, genetic testing, embryo freezing, embryo storage, donor sperm, donor eggs, and sometimes more than one cycle are included. The number shown on a clinic page may not include everything a patient eventually pays, especially medications, genetic testing, storage, and add-on services. Here are 7 questions to ask before you borrow money for IVF. Question 3. What happens if the cycle is canceled? Sometimes a cycle changes before retrieval or before transfer. Ask your clinic and financing provider what happens if treatment is paused, canceled, converted, or delayed. You want to know whether the money is still owed, whether any portion is refundable, and whether it can be applied to a later cycle.
Question 4. What interest rate and total repayment amount will you pay? The monthly payment is not the real cost. Ask for the total amount you will pay over the life of the loan, including interest and fees. Also ask whether there is a prepayment penalty if you pay it off early. Question 5. Does insurance cover any part of the plan? Even if IVF is not fully covered, insurance may cover diagnostic testing, monitoring, medications, or parts of treatment depending on the plan. Ask whether IVF, IUI, medications, prior authorization, and out-of-pocket costs are covered before beginning treatment. Question 6. Is there a refund, shared risk, or package program? Some clinics or partner programs offer package pricing, refund structures, or bundled payment options. These can be helpful for some patients, but they can also have eligibility rules, exclusions, and emotional pressure. Ask for the terms in writing. Question 7. What is the plan if you need more than one cycle? Many people budget for one IVF cycle, but treatment may require more than one retrieval, more than one transfer, or additional testing. Ask your clinic what a realistic second-step budget might look like for your situation. Before you sign anything, ask for a line-item quote, a medication estimate, a copy of the financing terms, and a written explanation of what happens if your treatment plan changes. This channel is educational only and does not provide medical, legal, or financial advice. Talk with your clinic, insurance provider, and a qualified financial professional about your personal